Hi everyone. This is Thomas Chu drawing here, and I have our friend Alan Su with us. Alan's Chinese name is Feng Kan Wood. I'm very honored to have Alan with us. Alan is the founder of Medi & Co. And also it is a social enterprise, the legacy of Mighty Medi. Alan, may I introduce you to our friend and you say something about yourself?
Thank you, Thomas.
Alan, please go ahead. Yeah.
Thank you. Thanks for having me on. My name is Alan. I'm an Australian-born Chinese. Um, the reason why, I guess, for this introduction is my daughter. My daughter was diagnosed with a childhood brain cancer known as DIPG. Maddie, she had passed away last May, so about almost 9 months ago. She had a very rare form of brain tumor. Rare. When I say rare, it affects about 20 children in Australia, and normally focuses on affects children, and the average survival length was only 9 to 12 months. Luckily, Maddie was able to survive a little bit longer than that, 3.5 years, through various interventions, and it involved surgery with Charlie Tia, radiotherapy, and Chinese medicine, and a few other treatments.
Sorry, Ellen, that reminds me about your lovely daughter, Maddie, whom you mentioned to me during one coffee break several years ago. And you told me that she got a problem. You would like to take her to see the doctor at the hospital. 3 hours later, you told me that Maddie been diagnosed with DIPG and you need to find very good surgeon. And for you, I know Professor Charlie Teo. And I've been very fortunate to be trusted by you and later on by Charlie. And I note from the diagnosis recording, Charlie mentioned to you the risk of having the surgery to be conducted to Medi. And the risk been very high, and I also advise you in my capacity as a lawyer and friend, don't do it. And thereafter you discuss with your wife, eventually you and your wife decided to go ahead. And that proved that you guys been doing a very good decision, because that extend the life of Maggie to at least 3.5 years. I think it's exactly. I think it's 3 years and 9 months. Correct me if I'm wrong. I give it back to you, Alan.
Yes, around there. Yes, Professor Charlie Tia was. We were very fortunate to be able to meet with Charlie, and he was one of the very few neurosurgeons in Australia. It was who even around the world who can actually operate on this particular type of tumor. It's a high risk surgery, but Charlie had almost 40 years experience, over 11,000 surgeries, and he specialized in brainstem gliomas, which Maddie had one of those tumors. And mind you, not all patients with this type of tumor can be operated on. But when when he looked at the MRI scans, he found some focal components, and he told us about the risks, and we thought, it's worth taking. We were very lucky that we had a good outcome. We could have easily a bad outcome and, affected her quality of life, but she had a good outcome thanks to the skills of Charlie, obviously very experienced neurosurgeon, and knew what he was doing. Her tumor was made smaller. He did tell us that this only buys more time. But as a parent, when you go to the hospital and they say, "Oh, your child only has 1 year to live," what do? I was in denial. I didn't believe it, and you always have hope for a parent whose child has a short prognosis is everything. So we took the risk and made the decision for the surgery, and we're very lucky to had a good outcome, and that bought her more time. I'm not saying that was the only thing that helped her, amongst other things, but obviously it did certainly extend her life and quality of life.
Yeah, for the benefit of those who just join us or who never follow our cases in terms of Ellen's lovely daughter, Maddie. In fact, Maddie become sort of an icon in Australia, being highly publicized by medias in terms of her bravery. She always smiled, even after very stringent medical checkup and so on. So she's being regarded as one of the young heroes in Australian histories. So Ellen, would you mind to elaborate on that?
Yeah, sure. So Maddie, at the time she was diagnosed, she was only 6. But for 3 years, 3.5 years, she was fighting. She had to go to hospital, do a lot of blood tests. She did a clinical trial. She did radiotherapy. And, that brought her a really good quality of life during that time. And she had, due to the nature of the tumor, it was malignant and is in the brain stem. So the brain stem is a very sensitive part of the brain where, breathing, heart rate, movement, it affects all the vital components of the human body. And there was no cure. There's been no cure since day one for 60 years. And the standard treatment for these kids is just standard radiotherapy, which only buys time. So
Yes.
Maddie was lucky that she had 18 months of really good quality of life, and then the tumor started progressing, and she went on a trial, re-radiation that extended her for another 9 months, and we were running out of options because there's not many treatment options available, if anything, in the industry, especially in Australia. And
Right, I understand. That's the reason why when her case relapsed again, I joined you to go to Beijing and to have one of sort of the major operation being done there. So can you elaborate on that one as well?
Yes. So obviously during that time, there was a lot of controversy, especially around Charlie. He couldn't operate in Australia because he had a couple of complaints from the Healthcare Commission. Out of 11,000 surgeries, he had a couple of bad outcomes and complaints from patients who have now passed. And unfortunately, they made he had a hearing, and his license was restricted on a couple of these high risk surgeries, of which Maddie had the DIPG, which is brain stem glioma. That was one of the high risk surgeries that he needed a second opinion, another expert in Australia to say, okay, you can do it. Unfortunately, his peers in Australia was not able to help him, and he had to go overseas. So during that time, Charlie, we actually had not many options left, and he recommended a vaccine specialist to look at a custom vaccine to be made, which needed tumor, and we ran out of tumor samples, and the only way is to go overseas to do it. So thanks to Thomas knew the right people, Professor Ling and her contacts, was able to open the door in Beijing at China INI, which is one of the top neurosurgery hospitals in the country. And we were able to go over there and do surgery with Charlie. This was
Actually,
in March.
to pause a little bit on this one, I'm sorry to interrupt you, Alan, in relation to my participation with Charlie, only because you sent over Charlie's diagnosis prior to the first operation, the surgery to Maddie several years ago. I start to know and understand how Professor Teo been doing things. He impressed me as a very prudent doctor. He explained very detailed to you about the process and what happened, the risks, and so on and so forth. So I was very surprised when he was adjudicated by the tribunals as not being professional, which I totally disagree. In fact, my peers in the legal profession in Australia, even in UK, also think that it's not a very fair tribunal trial. So we try our very best and thinking of clearing the name of Charlie in the near future. But anyway, back to what I say, who's Professor Ling is. So when I know that Charlie being sort of prohibited from doing serious operation to patient in Australia, I mentioned to you, Alan, I try my very best through my network in China to make sure that Chinese skills could be sort of spread around. At least he can teach young Chinese surgeons to do this minimal invasive surgery. So I've been very lucky, and also due to the skills of Charlie himself, he been highly recognized and embraced by the Chinese medical profession. So Charlie can do all kinds of surgery with full licensing in China. So that is a very good outcome. But in short, that's the reason why I joined you last year to Beijing to make sure that Mehdi and the other patients from Australia being well taken care of by INI, the leading hospital in China. So unfortunately, the case for Mehdi didn't look good, and eventually she passed away. But her legacy lives on. And the other lady who received the operation at the same time with Maddie been doing very well with the vaccine done by the very knowledgeable specialist, uh, Dr. Professor, I think it's Nicholas Petrosky. Can you elaborate on it?
Yes, so Nicholas Pastrosky is an Australian vaccine specialist, one of the top vaccine specialists over the last 30 years. Done a lot of research, cutting edge vaccine of development. And his vaccine is very different to your traditional mRNA. He utilized a lot of his a lot of funding from the US. And I think over his 30, 40-year career in developing vaccine, he has an autologous personalized cancer vaccine, which is developed from the tumor itself. And so that made a lot of sense, even though it wasn't approved for it's only been tried for a few cancer patients. It hasn't been tried on children, especially for DRPG. And so, this is all cutting edge things. There's a lot of red tape in Australia and ethics and, getting approvals, but we had no choice. We, as a father, as a parent, you want to try everything. And the problem in Australia is you have to follow the process. If you follow the hospital system, sometimes you don't get the right advice, or they just go with the status quo, whatever is the least risk, or minimizing any litigation. But for us, we wanted to try out new therapies that we believe that could work. Even if it didn't work, and in this case it didn't work, it opened the door to allow. She was the first to try this vaccine. She was the first
Yeah.
to go to China for this type of operation. It allows the future patients who are diagnosed with this horrible disease to be given another option. Parents should be able to make the decision for their child or what's best for their children, not the other way around. And
Yeah.
it was tough decisions, but I don't regret any of the decisions that we made. We were at the forefront of new development. In fact, this new cancer vaccine, I really believe that personalized vaccine is a way of curing cancer. But of course, we need to spend more money and investment into research. And unfortunately, like Australian government and a lot of other governments around the world, they don't invest in this research. Why? Because it's a numbers game. Unfortunately, childhood brain cancer, it only
Yeah.
affects such a small population of the world.
Yeah, Alan, correct me if I'm wrong. In fact, the Australian government already allocated 20 million Australian dollars to cases like Medi last year, and recently another 2 million to Professor Matt Dunn. I call Professor Matt Dunn, Petrosky, and Charlie Teo as the three musketeers in this advanced technology and surgery. So what is your comment?
Yes, because the Australian government over the years did not fund particularly childhood brain cancer, it's unfortunately parents like us and a few other parents, they have to, advocate for more funding. And so Maddie was very fortunate that she was chosen as the face of the Sunday Telegraph, which is a large media company in Australia newspaper, to be the face of the RPG to campaign the Australian government for more funding. And not only her, a few other families in similar situation help successfully get the government to commit funding. $20 million is really not a lot of money over 7 years, but it's still better than nothing. It's a start. And
Yes, thank you, Alan. For the benefit of our supporters, I will post all the records of what we discussed, also in relation to the Australian government's allocation of funding in the research of DIPG, onto our website called ECHO. ECHO stands for Ethnic Communities Homeland Opportunities, taking care of all the minority groups all around the world. And at the same time, I think DIPG should be more or less promoted through advanced technology, in particular, all the availability of specialists in China, and also for the recent DeepSeek achievement in the world invented by Chinese specialists. I believe DIPG could be promoted for attention of all the government, in particular with the Chinese government. So for that reason, this video is the first one to draw the attention of all parties, in particular people like Professor Teo and so on. By the way, I would like to mention a little bit about Professor Ling herself. Professor Ling was one of the legends. She saved the life in 2002 of a TV anchor. Her name is Tanya Liu. She sustained serious brain injury in a train accident in London in 2002. She was diagnosed as almost technically dead, but Professor Lang flew to London, accompanied the patient Tanya Liu back to her hospital, now called INI, in Beijing, where Mehdi had an operation. And Professor Leng saved the life of Mehdi Liu. And 2 years later, in 2004, I beg pardon, so it should be Tanya Liu. Tanya recovered about 2 years later, and Tanya Liu talked about her case in People's Hall of China in year 2004. So Professor Leng is very famous in China. And she liked the idea of what Charlie did. So that's why she welcomed Charlie and helped him to rebuild his profession in China. So we're looking forward to the achievement jointly with Professor Leng and Professor Teo in relation to expanding the research of DIPG in China. By the way, Alan, you may recall on the 24th of last month, Charlie and Professor Leng did a very good job on another patient from Australia. Her name is also called Tanya. Can you elaborate on that?
Yeah, so because of Charlie's restriction, he is now forced to go overseas to do any sort of surgeries. It is really a loss for Australians because he's no doubt one of the most talented neurosurgeons in Australia and around the world. And he's got so much knowledge, so much skills and experience to impart on other neurosurgeons. And we're very lucky that he's able to achieve this now in China. But for Australians who need to do surgery and need his services, they have to go overseas. One Australian in particular, her name was Tanya. She is a mother of 4, I believe, Australian lady. She had glioblastoma, a very aggressive type of brain tumor. Decided to go to China to allow Charlie to operate on her. While she was in Hainan, they found another tumor, and they were able to, the Chinese doctors, alongside with Charlie and Professor Ling, were able to remove the tumor, and the outcome was really good. She was up and walking within the next day, and she had a very, very good outcome. This is just one example of many to follow, but that just demonstrates that who needs. There's patients that out there that need Charlie's expertise, they need to go overseas to do it, they can do it in China. And 10 years experience, and she had commented in the newspaper articles, was a very good experience, and you know, that should be made aware for not only Australian public but for around the world, because the Chinese doctors are very open-minded, willing to learn new skills, and you know, the setup and the infrastructure that is built in Hainan will be ready to accept not only Chinese patients but patients from all over Asia, including Australia and the rest of the world.
Thank you, Alan. Sorry to interrupt. Would you mind to mention to our audience about the wonderful journalist, Sidonie Martin, a very good friend now to you and to your daughter? Can you elaborate on that one?
Oh, sure, yeah. So Sidonie, she was a former patient of Charlie Teo. She also had brain cancer some years ago. She works for News, which is Sunday Telegraph, and she was the one that reported on the stories, particularly Maddie with the Maddie's Wish campaign, help lobby the Australian government for more funding towards research, and you know, supporting Charlie. You know, explaining the whole story to the public, because there's always two sides to the story. And she was able to express the support of many patients that Charlie had, and all the positive outcomes that have, not just the positive ones. So it gives you a bit of balance in the media of the real. You don't know until you know, you can read the newspaper or watch TV, the media, and they don't always get it right. You know, and she was able to give a very fair and give power to the patients to be able to voice and advocate for better solutions. And Charlie is definitely one of the losses to the Australian community.
Yes, indeed. Actually, end of this year, December the 31st, Hainan province will turn into international free trade port. I look forward to the free trade port becomes the hub for promoting Medi and Co, Mighty Medis, and also DIPG through the help of media around the world, initially from Australia and also China. So I really would like to see that kind of things happening, and also to see by the time everyone will understand, it has been a big loss to Australians to have Charlie not being able to conduct surgery in Australia for fellow Australian patients. So looking forward to shortly to clear the name of Charlie. But at the same time, I really would like everyone to listen to you, Alan, how you see Australia and China relationship in terms of medical cooperation and advancement of medical research. Say, for example, with Professor Matt Dunn, Professor Nicholas Petrosky, Professor Charlie Teo, plus Professor Ling and her team all over China. Alan.
Yes, I mean, I'm not a medical expert. I was just a parent of a child who had cancer, in particular brain cancer, and for what mattered for me was the results. You know,
Yes.
and having parents or patients having a say in their treatment options. Unfortunately, in the space that you know, with DIPG, there was no cure, and you know, we're working towards a cure. This is a global issue. It's not just in Australia. But why should the minority be disadvantaged? We should be getting more support. But unfortunately, governments don't fund these sort of things. It's people who, patients or parents or families like us, who've been through it, who understand what it's like, who suffered, to support the cause. They would have to go set up their own charity, or you know, find ways to raise funds and put it towards medical research. This is only research that would advance to find a cure. And
Yes.
Charlie is one of several. He's a very skilled neurosurgeon. There's other very talented and researchers and doctors and people in the field trying to find a solution. And the key is about collaboration. Put politics aside, bureaucracy aside. What matters is the patient, saving people's lives, and finding a solution.
Can't agree more.
We're going to work together.
Yes, I've been thinking about the current achievement of DeepSeek, the AI model, now being very popular in around the world in more than 120 or 40 countries now. So I'm just thinking if DIPG research could be moved to Hainan as a main research hub, utilizing the mega computer and also the DeepSeek AI model to calculate, to do the research and so on. It would expedite the process of the scientific research, especially medical achievement. So you and Ellen are not expert in this field, but our good friend who's operating for us for today, he is an IT specialist. So I will discuss with him and through his peers to see how we can use all the scientific advancement in China to expedite the research of DIPG. And I look forward to the cooperation between scientists of Australia and China to work together for the betterment of mankind. And that is the reason why we have this first video for today. But this will be the first one for more to come. And we will set up a very special channel or column, so to speak, for Maddie and Kofi and for Ellen to promote the idea of DIPG on our platform, which is called ECHO. And I repeat again, it's ethnic community opportunity for all minority groups, for those who've been deprived. And those people who missed the contents of what we discussed or what I discussed with Ellen, please go to search on Google's or Baidu on our web link. I will put it in the description of this video so that people can do it by themselves and update themselves about the background of everything. In fact, Charlie Chiu been doing a lot of good work, roughly about 20 or almost 24 months now in China. So I was involved half of them. And also for Alan's case, I've been helping him and he and more or less debriefing me for a lot of good outcome. So for that reason, we look forward to the joint cooperation of Australia and China. Alan, do you have any further comment before we close?
No, I'd first like to say thank you to everyone who is listening. And, even though my daughter has passed, I feel responsible that I want to help other people, not just with, childhood brain cancer, just as a whole. I mean, cancer and serious illness is a part of life. It affects everybody. And we have to be able to find solutions. And the only way to find solutions is to put more money into research and advancement in science and technology. And we have to work together. Whether you're in Australia, in China, or anywhere around the world, we have to collaborate. So my aside, I set up Maddie & Co. and Maddie's Wish, which is a charity and social enterprise, to try to find alternative ways to fund brain cancer research, but at the same time to help everybody. So, to give back to the community. So, hopefully we can raise more awareness and be able to help as many people as we can. All in
Yes,
time.
thank you, Ed. Yeah, we look forward to seeing Hainan, the future free trade port of China, to become one of the leading medical research centers in the world for all patients, be they from China or elsewhere, including Australia. We are also looking forward to cooperation between Australia and China in all this kind of technical, scientific support and as well as research. Thank you, Alan, and thank you, everyone, and in particular, as well. Thanks, Bye-bye.
Thank you.
Bye.